Ever wondered what causes that sudden sharp pain in your lower back? Could it be a kidney infection? Kidney infections are more than just a simple nuisance. They can significantly affect your health and overall well-being. Understanding these infections, their causes, symptoms, types, and treatments is crucial to maintaining good health. Our kidneys, these bean-shaped organs in our body, play a vital role in filtering waste from our blood and regulating our body fluids. But what happens when these essential organs get infected? The impact can be quite severe, ranging from intense pain to potential kidney damage, and in rare cases, can even be life-threatening. That's why it's so important to arm ourselves with knowledge about kidney infections, to recognize the signs early and seek appropriate medical attention. Whether you're a health enthusiast, a concerned individual, or someone who's just curious about the topic, this information is relevant to us all. So brace yourself as we dive deep into the world of kidney infections. First, let's unravel the mystery behind what causes kidney infections. The most common culprit is bacteria entering the urinary tract. This can happen when bacteria from the skin or rectal area enter the urethra, travel up into the bladder, and then make their way to one or both kidneys. This is why good hygiene practices can actually help prevent these types of infections. Another common cause is urinary tract obstructions. Anything that slows the flow of urine or reduces your ability to completely empty your bladder may increase the risk of a kidney infection. This could include a kidney stone or an enlarged prostate in men. Finally, a weakened immune system can also leave you more susceptible to kidney infections. Conditions like diabetes, HIV, or certain medications can compromise your body's defenses, making it easier for infections to take hold. Now that we understand the causes, let's move on to the symptoms of kidney infections. The human body has a way of signaling when something is wrong. So, what are these signals when it comes to kidney infections? Typically, you might experience symptoms that seem like a common flu at first. You could have a high fever, feel a general sense of fatigue, or even experience chills. However, there are also symptoms unique to kidney infections. If you feel a persistent discomfort or pain in your lower back or sides, that could be your kidneys signaling a problem. Another telltale sign is changes in your urinary habits. You might find yourself needing to urinate more frequently, or you may notice that your urine is cloudy, smells strong, or even contains blood. Some people also experience nausea or vomiting. It's crucial to remember that these symptoms can vary greatly from person to person. Recognizing these symptoms is the first step towards diagnosis, which leads us to our next segment. Did you know there are different types of kidney infections? That's right, not all kidney infections are the same. Let's delve into two main types: acute and chronic pyelonephritis. Acute pyelonephritis is a sudden and severe kidney infection. It causes the kidneys to swell and may permanently damage kidney function. You'll often find it accompanied by symptoms like back pain, fever, and frequent urination. On the other hand, chronic pyelonephritis is a long-term condition that can lead to scarring and eventual kidney failure if not addressed. It's a bit trickier to spot, as symptoms can be mild or even absent in the early stages. Over time, though, signs such as hypertension, fatigue, and a loss of appetite can start to show. So, whether it's an abrupt onslaught or a slow-burning issue, kidney infections come in different forms, each with its own set of challenges. Identifying the type of infection is crucial for diagnosis and treatment. Now, how do doctors diagnose a kidney infection? This is a question that has a few answers. The process typically starts with urine tests. Doctors analyze a sample of your urine to detect whether there's an elevated level of white blood cells, red blood cells, or bacteria. These are telltale signs of an infection. In some cases, doctors might also recommend imaging tests. This could be an ultrasound, a computerized tomography scan, or a type of X-ray known as a voiding cystoretrogram. These tests help visualize your urinary tract and kidneys, revealing any abnormalities or obstructions that could be causing an infection. For those who have recurring kidney infections, doctors might conduct a cystoscopy. This involves inserting a thin tube fitted with a lens into your urethra to examine both it and your bladder. Diagnosing kidney infections is crucial to prevent complications and ensure effective treatment. Once diagnosed, the next step is treatment. So, a kidney infection has been diagnosed. What happens next? Once you've been diagnosed with a kidney infection, it's time to start treatment. The most common treatment for kidney infections is antibiotics. These powerful drugs kill bacteria, which are often the cause of kidney infections. Your doctor will prescribe the type and dosage of antibiotics based on the severity of your infection and your overall health. You'll likely start to feel better within a few days, but it's important to take the entire course of antibiotics to ensure the infection is completely cleared. Sometimes, kidney infections can be severe or complicated. In these cases, hospital treatment may be necessary. This usually involves receiving antibiotics and fluids through an intravenous drip. This method ensures the medication goes straight into your bloodstream, offering a faster and more effective treatment. You might also need to stay in the hospital for monitoring, especially if the infection has spread to your bloodstream or caused other complications. In rare cases, if the kidney infection is caused by an underlying condition, such as kidney stones or an enlarged prostate, surgery may be needed. The procedure will depend on the underlying issue. For instance, if kidney stones are causing recurrent infections, a procedure to remove the stones might be performed. Similarly, if an enlarged prostate is causing urinary tract blockages leading to infections, a surgery to reduce the size of the prostate might be required. Remember, these treatments aim to eradicate the infection and relieve symptoms, but they also work to prevent potential complications such as kidney damage or sepsis, which is a life-threatening response to an infection. Throughout the treatment process, it's crucial to communicate with your healthcare provider. Report any new symptoms or concerns immediately. The sooner an issue is identified, the sooner it can be addressed. While medical treatment is essential, there are also home remedies that can help. We'll delve into that in the next segment. For now, remember that treating kidney infections is a matter of speed and efficacy. It's not something to be taken lightly, but with the right care and attention, recovery is more than achievable. Home remedies can be a supportive measure for dealing with kidney infections. But what are these remedies? Let's delve into some common home remedies that can help ease the symptoms and promote recovery. However, it's essential to remember that these are not a substitute for proper medical treatment. Firstly, hydration is key. Drinking plenty of fluids, especially water, can help dilute the urine, making it easier for your body to flush out bacteria. Hydration can also reduce the risk of developing kidney stones, which can lead to infections. Next, avoid beverages that can irritate the bladder, such as coffee, alcohol, and carbonated drinks. These drinks can exacerbate the symptoms of a kidney infection and can potentially hinder your recovery. Instead, opt for herbal teas such as chamomile or cranberry tea, which are known for their antibacterial properties and can soothe the urinary tract. Another effective home remedy is applying heat. Using a heating pad on your back or abdomen can help alleviate kidney pain. The heat helps to relax your muscles, thereby reducing discomfort and promoting healing. But remember, it's important not to apply the heat directly to the skin or leave it on for extended periods to avoid burns. Including vitamin C in your diet can also be beneficial. This powerful antioxidant helps prevent the growth of bacteria in the kidneys by acidifying the urine. Foods rich in vitamin C include oranges, strawberries, bell peppers, and kiwis. In addition to these, maintain a balanced diet. Consuming foods rich in probiotics such as yogurt and kefir can help strengthen your immune system and fight off infections. Avoid high-sodium foods as they can increase blood pressure and put additional strain on your kidneys. Lastly, rest is crucial. Your body needs energy to fight off the infection and recover. Ensuring you get enough sleep and reducing stress can significantly improve your body's ability to heal. Remember, these home remedies are supportive measures and should not replace medical treatment. Always consult with your healthcare provider for a comprehensive treatment plan. These remedies can complement your treatment and help you recover faster. So, we've covered quite a bit about kidney infections. Let's do a quick recap. We started off by understanding what kidney infections are, moving on to the causes. These could range from urinary tract infections to certain types of medical conditions. Then we delved into the symptoms, which can include everything from back pain to frequent urination. Next, we touched on the different types of kidney infections, such as acute and chronic. We also discussed how these infections are diagnosed, typically through urine tests or imaging studies. We then explored the various treatment options, which can involve antibiotics or, in severe cases, surgery. Lastly, we highlighted some home remedies that can assist in managing the symptoms, like adequate hydration and over-the-counter pain medication. Remember, understanding kidney infections can help in early detection and treatment. Stay healthy, Stay informed.